Good morning, everyone. Today we are going to discuss vitiligo, a common acquired disorder of pigmentation that affects about 1% of the world's population. It's crucial to understand that vitiligo is not just a cosmetic issue. As clinicians, we must be sensitive to the fact that vitiligo can have significant psychosocial impact, especially due to its visible depigmentation, and this is often most pronounced in patients with darker skin types. Vitiligo is considered a multifactorial condition. There is often a genetic predisposition, and many cases involve an autoimmune process in which the immune system targets and destroys melanocytes, the cells responsible for producing pigment. It typically presents with asymptomatic, sharply demarcated, depigmented macules or patches. The classic description is that stark, milky white color. There are usually no clinical signs of inflammation, no redness or scaling, just that stark loss of color. The edge, or border, is typically well demarcated. These lesions can appear at any age and on any body site. We broadly classify vitiligo into two main categories, segmental and non-segmental forms. The first is segmental, which usually affects one side of the body in a dermatomal or dermatomal-like distribution. It often begins earlier and tends to become stable after a period of activity. Then there's non-segmental vitiligo, the most common type. It is typically bilateral, more generalized, and may be progressive. Non-segmental vitiligo can be further described by patterns such as generalized disease, acral or acrofacial disease involving the extremities and face, and universal vitiligo with near total body involvement. This next point is critical for clinical practice. Vitiligo is strongly associated with other autoimmune conditions. We see a very high frequency with thyroid disease, such as Hashimoto's or Graves'. It is also linked with conditions like alopecia areata, psoriasis, inflammatory bowel disease, and other autoimmune or genetic disorders. Because thyroid disease is relatively common in patients with vitiligo, it is reasonable to screen all patients for thyroid function. For diagnosis, vitiligo is most often a clinical diagnosis. When the appearance is atypical or the cause of hypopigmentation is uncertain, a skin biopsy can help. It typically shows an absence of melanocytes in affected areas. Aside from thyroid screening, additional laboratory tests are not routinely required unless the clinical picture suggests another associated condition. Now let us turn to treatment goals. Vitiligo is a chronic relapsing condition. Treatment is aimed at two main outcomes. First, stabilizing active disease, meaning stopping further spread, and second, achieving repigmentation of depigmented areas. It is important to counsel patients that response is often slow and can vary significantly depending on the patient and the body site. If the disease is rapidly spreading, the priority is stabilization. In that setting, oral corticosteroids and slash or narrowband ultraviolet B phototherapy are commonly used to help stop further spread. If the disease is stable, treatment is chosen based on how widespread it is. For limited areas, first-line therapy is usually topical anti-inflammatory treatments, such as topical corticosteroids or topical calcineurin inhibitors, especially for sensitive areas. For more widespread disease, narrowband ultraviolet B phototherapy becomes the main approach. If patients do not respond, other options exist, but the overall approach remains the same. Stabilize active disease when needed, and then use topical therapy and slash or phototherapy over time to achieve repigmentation. To summarize, vitiligo is a common multifactorial depigmentation disorder with important autoimmune associations, especially thyroid disease. Diagnosis is usually clinical and management is individualized based on disease type, activity, and extent. Treatment requires patience, clear expectations, and a patient-centered plan because progress can be slow, but early stabilization of progressive disease can make a meaningful difference.